IDEAS received a grant from the Bill and Melinda Gates Foundation to investigate change in maternal and newborn healthcare in settings where they're investing to increase demand and enhance supply of maternal and newborn care using innovative approaches. And their Gates Foundation focus in Ethiopia, in the state of Uttar Pradesh in India, and in northeast Nigeria is really simple. It's because with the very large populations and high mortality, there's the potential to save the largest number of lives. So inevitably these three geographies have got really different contexts: politically, religious, ethnicity, health systems, all very different. So it's quite difficult to to synthesize evidence across the three. But an emerging picture was that we are seeing improvements in people wanting to access antenatal care and to deliver in health facilities. And we're seeing some mixed change in the quality of healthcare that's being delivered, although there's still quite a lot of work to be done on quality of care for mothers and newborns. Just thinking about each one individually, Ethiopia experienced really rapid change in the period 2012 to 2015, and that change continues beyond that time. And the change was experienced, I think, across the country as a whole. But they started from a very low point, but they've reached levels now that are comparable to the other two geographies in terms of the number of families accessing care. And at the same time, we are seeing improvements in quality of care across the board. Obviously, still a lot of work to be done. In Uttar Pradesh, the area in which we were working was actually not amongst the most poor districts in Uttar Pradesh. So there's a huge amount of disparity in Uttar Pradesh. It's an enormous state. And what we observed in where we were working in Uttar Pradesh, were actually a large number of families are accessing antenatal and intrapartum care. But the quality of care is really stubborn to shift, and we observed very little change there. And then in Nigeria, little change in terms of the number of families accessing care, but some really positive improvements in behaviours both at home and in facilities for the immediate care of the newborn. So specifically positive changes in immediate thermal care for newborns. So projects have been able, for example, to encourage people to delay the bathing of the newborn for the first day of life, and they've been able to do that quite successfully. But one of the things that did emerge across all three geographies as an urgent priority is that postnatal care for the mother and the newborn in the first day or two after life, well, it's a really high risk period, isn't moving anywhere. Coverage of that care is still very low. The quality of the care still needs a lot of improvement. And specifically, care seeking for newborns with danger signs needs to be improved everywhere. So definitely the newborn care needs attention everywhere. And we need to really think about strategies that work in the context of increasing facility delivery. Where should that immediate newborn care be provided? Are we looking for good quality postnatal checks before women go home after delivery? Or are we looking for home visits by community health workers, even for women who've had a facility delivery, only for those who've had a home birth? I think we need to think long and hard about how to improve postnatal care and save more newborn lives.